Hi, this is Dr. Singh. I'm a board-certified physician in internal medicine and nephrology. I practice here in Las Vegas at Healer and Rare Weight. Now, losing weight is hard, especially as we get older, our metabolism slows down. Many individuals also have genetics that favor abnormal weight gain. I have several patients who struggle with losing weight, despite eating healthy and exercising, and I know how frustrating that can be. Now, in our practice, we have used phentermine and many other FDA-approved weight loss medication with really good results, great success. Now, one of the newest drugs that has been approved is called Semaglutide, often referred with the brand name called Wegovy, and we've seen very good results with this new medication. So what is Semaglutide? It's a GLP-1 agonist or a glucagon-like peptide agonist. Now, before we learn what this mouthful word GLP-1 is, we have to learn about glucagon a little bit. So glucagon is a hormone which is produced by the pancreas, alpha cells to be precise, whereas insulin is produced by the pancreatic beta cells. Glucagon does a lot of things opposite to what insulin does. So as you can see in this picture here, insulin causes glucose to be converted, gets stored as glycogen in the liver, which causes a decrease in the blood glucose levels, right? Now, glucagon, on the other hand, it causes the glycogen that is already stored in the liver and converts it back into glucose, which is released into the circulation. So that's what we want. Now, semaglutide, it's a GLP-1 or a glucagon-like peptide. Now, in our body, we already have GLP-1 hormones, which are produced by the small intestine. Now, this GLP-1, it binds to a GLP-1 receptor, which is present in a lot of our tissues, such as pancreas, our stomach, lungs, the heart, the kidney, even our skin, and in the brain, in the hypothalamus region. Once our body has semaglutide, either naturally or when we inject this medication, it causes a few things. One, it causes conversion of the liver glycogen, converts it into glucose. Medication also slows down the gastric emptying. So once we eat something, our stomach has a transit time where food sits in our stomach and it's pushed out. When you take this medication, that process is slowed down. So naturally, when we have food in our stomach, we don't feel as hungry. And also you have a sense of fullness, so you'll eat less. So in short, this medication works by reducing hunger while promoting a feeling or sense of fullness. When it comes to dosing, the medication semaglutide stays in the body for 6 to 7 days. So all you need is once a weekly dose. It has to be given as an injectable form. So it's 2.4 milligrams. It's injected subcutaneously, same day, every week. So if you start your program on Monday, make sure you inject every Monday. Now, a common question, actually one of the main questions I get asked is, how much weight can I lose on this medication? Right? Everybody wants to know that once they start the program. Now, average weight loss in the studies was about 15 to 25%. Now, when you combine with modification in diet and exercise, you can lose even a lot more. So if you are 300 pounds, you can expect to lose between 45 to 75 pounds, which is a really good weight loss. And another good part of this medication is that you generally do not regain the weight back even once you stop taking this medication. Now, there are many clinics that do advertise that you don't need to exercise with this medication, which is true. You can lose weight without exercise and just with this medication. However, I'm against such recommendation. We all need to be practicing a healthy lifestyle, which includes eating well and staying physically active. It can be just a walk 30 minutes a day. Remember, you don't want to be overweight the rest of your life. And also, you don't want to be taking medication the rest of your life. Our goal is to minimize the number of medications. So practicing a healthy lifestyle will make sure that once you lose the weight with this program, you don't gain it back, right? Now, who should not take this medication? So if you already had pancreatitis, you got to be extra careful, because that can get, you can have a recurrence of the same inflammation of pancreas. Kidney patients with chronic kidney disease, be extra careful. If you're a type 1 diabetic, you shouldn't be taking this medication. If you already have gastroparesis, which is a condition where your stomach transit time is already slow, which is common in diabetics, so you have to be extra careful, as that will get worse once you're on semaglutide. And thyroid cancer, right? So do not take this medication. Now, with all medication, we naturally have to talk about side effects. Now, there's not much major side effects with this medication. However, there are very common side effects such as nausea. 80% of the individual can experience nausea. It sometimes can be quite severe. So we'll often prescribe an anti-nausea medication to take along with this. You can also have vomiting, diarrhea, constipation. Now, if you're an individual who has irritable bowel syndrome, symptoms can get worse. Doesn't mean you can't be on the medication. You just have to be extra careful that while you're on the medication, your symptoms may get a little bit worse. Overall, I think the addition of this new medication is a game changer for individuals, especially the ones who had trouble losing weight with traditional medications, phentermine, diethylpropion, naltrexone, and so many others. Now, I highly do recommend that you follow a healthy diet and follow exercise regimen while you're on this medication. So that's all for today's video. I hope this was helpful. Please do not forget to like and subscribe. And if you have any questions or comments, please leave them in the section below. I'll definitely read them and reply. Thank you again, and I'll see you back in a couple of weeks. Bye-bye now.